Um, yes, today I'm gonna describe an article about pattern of antibiotic usage in children hospitalized for common infection disease, and it is published by 2017, which is done by a group of the physicians or what you call it, um, residents of doctors, uh, and it is supported by what you call it, the Pediatric Infection Research Center and Research Institute for Children's Health under Shahid University of Medical Science. This university is one of the top five university in Iran. Yes. And let's go for background. Yeah, let's see what happened in the background. As you see here, they are explaining about antimicrobial resistance. That's, as you see here, misuse is one of the major one of the major cause of antimicrobial or antibiotic resistance. Overuse and misuse of antibiotics, which have been seen or observed globally, and this problem will have been assumed later. So the evidence points which to fact ultimately, as you see here, is directly linked to antibiotic usage, multiple drug resistant microorganisms, and this link in development of new antibiotics. So the antimicrobial resistance is linked to these things. So most of the research, our researcher have here that world is heading to post-antibiotic era. That means post-antibiotic era. That means the world is going after antibiotic usage, means when some antibiotic cannot be effective in the common disease. As you see, when human being may die of common infection disease, when an easy treatment of antibiotic is available. And other things that can effective or affect in the antibiotic resistance, as you see here, prescribing error. So, which cover a wide range from prescribing antibiotics or wrong antibiotics, prescription, wrong dose, and improper route, and also prolongation of durations. On the other hand, there are so many studies on antibiotic usage for inpatients that that shows about antibiotic having prescribed in unnecessary or needless in almost of the 1 of 3 patient who is hospitalized. So most of the research our authorities agree with that the effective surveillance of antibiotic usage is essential for controlling unnecessary or incorrect antibiotic administration to prevent antibiotic or antimicrobial resistance. So based on this background, we can understand they are focusing or they are addressing the issue of antibiotic, as you see the title in children hospitals. So next slide. As you see here, the objective is to determine pattern of antibiotic usage in previously healthy children hospitalized for common infectious or infection disease in a tertiary care hospital. So as I was told before, they are searching for issue of antibiotic usage. So let's go for material and methods. As you see at the study design, I think so. This part I written by myself. I'm not sure about that. And this study is retrospective and prospective observational study. And this study is made of two parts, as you can see here. So this is the canteen of first part, or this study is second part of the previous study. In the previous study, as you see here, have been done between October 2013 to September of 2014. And on that study, they were focusing on the rationality of drug usage, means antibiotics. And they continued it for second study, and in the end of the 2014. So source of data and materials. As you see here, so they try to make a question form or data collection form based on the WHO protocol. As you see here, what's the code or linking of that protocol is here. And so in the first study, they will try to collect the basic information about patients' profile and medications. As you hear, patients' demographic, discharge diagnosis, and hospital course, and some other information about the medications, means antibiotics. And they include the same information along with some other additional information as laboratory imaging result and all the details about the antibiotic have been prescribed and also prescribed in the second study, as you see here, type, dose, route of administration, and durations, and any change in difference. So, inclusive of this study, as you see here, they were collecting the cases recorded with underlying chronic disease that would make them, means children, prone to repeat it, means that chronic disease become to repeat it or become to serious infections. So they exclude immune deficiency and a major congenital or congenital abnormality or other abnormality were excluded in this study. And method of the collection of data. Yes, data was collected previously and analyzed in the first study. So they were tried to collect data from some common specific infection diseases you see here, UTI, meningitis, acute meningitis, and pneumonia, FVLS or fever without the localized source, and acute gastroenteritis. So, in the prescription, prescription have been made by the attending physicians and change, approved, and anything else. So, this prescription have been reviewed by the this prescription have been reviewed of antibiotics for any property, type of antibiotic usage, dosage, and duration treatment. All of these details have been checked based off hospital protocol, international guideline, and some recommended textbook, pediatric textbook, as you see here, Nelson textbook of pediatrics. Is there any question? No. Okay, let's go for next slide. So, let's study procedure. So, as you can see here, data was collected from the first study, as I told before, and to define the antibiotic pattern. In those specific details, as I told you in the previous slides. And All of this data was collected and checked in both parts, first and second. Checked by the two of the pediatric disease specialists, and to check all the properties or appropriateness for prescribed antibiotics, and if there was any disagreements, it will be checked or rechecked by the third man and by third physicians or specialists. All of data was have what you call it will go to a computer system, as we see here. I don't know, IBM SPSS static version 22. I think it's one version, computer version or application to check percentage of the antibiotic usage different for different patient calculation. What calculation, yes, and rationality prescription, and also dosing error and treatment duration. As you see here, this study have been done for both of the study after within the 5 or 6 years. First part have been done in from October 2013 and to September of 2014, and second part will start in the end of 2014 to 2016, and it is published or was published by 2017. So the study site was as you see here, there was two center, but mostly have done in one of the center, tertiary care hospital. It was under or linking with Shahid-based universities. So let's go for results. As you see here, so totally they were focused on the 140 patients. And from this 140, 74 patients have been treated for what UTI or urinary tract infection. 31 patients was for pneumonia, 25 for acute meningitis, and 24 patients have been treated for what gastroenteritis, acute gastroenteritis, and 13 patient was for fever with localized source. So totally 208 antimicrobial or antibiotic was prescribed for these patients, and the average rate was I didn't mention here, was 82 or 82.4 percentage, that given at the average of 1.82 antibiotics per patient, means 1.82 antibiotic was given to patients. Yeah, in the continue, 90 different antibiotic have been given. So 90 different antibiotic and 2 antivirals, as you see here, acyclovir and acetylvir was prescribed for the patient. Most frequency of antibiotic was what ceftriaxone. And more than 25 percentage of this antibiotic or of this total antibiotic and antiviral was needless, means was not necessary to prescribe for the patient. And 91.6 of this medication have been prescribed in generic name. Dosing error, they didn't clear it. What is the dosing error? Medication or their dosage. 70% was less than, it was less than 7%, and they have received from this 140 patient, they have received 25.6 of this patient had prolonged duration, means more than the real duration of the use of medication have been given in more than the real times. And most of the route of the prescription was proper and was given correctly. So If there's no questions in the results, let's go for discussion. Yeah. So less than 9% of the antibiotic was given to children orally, and other 90, more than 90 was given parenteral. So based on this study, in Croatia, more than 30 percentage of the there was a study, there was a study in the Croatia, and that shows more than 30 percentage of the antibiotic was received orally, as we see in the continuous. But in India, in a medical emergency units, mostly a high rate of the parenteral antibiotic are used. Means they are using parenterally for the patients of these antibiotics. And some other details I explained about switching from parenteral from one route to other route, parenteral to oral. Once that means it can be happen once for child, it is a step, and also orally can be given, or initially it can be given by orally, and especially in the UTI patient or children with UTI pneumonia, and why? Because overuse of the injection leads to numerous or so many adverse effects. Some of them, you can say, yeah, some side effects I was given like blood-borne infections. Yeah, yeah. As you see here, so based on this study, usage of a wide range different antibiotics for treatment of common infection in this study was showing there is a lack of uniform or uniform or improper antibiotic prescribing policy in this study or in this center. So I told you there was two centers of this study. Also in the center was reported like this, and in other center have been same reports. A wide range of antimicrobial had reported usage. Yeah. In addition, about it was explaining, some studies have been done within 10 years to check the bacterial resistance of the cephalosporin and ceftriaxone. And most of the reporter was explaining the ceftriaxone have the high range or what you call it, reported of the side effects, which can cause so many, as we see here, urolithiasis, and hemolytic anemia, and also severe morbidity and mortality. So it was explaining the ceftriaxone had so many adverse effects. Also, there was a article and based on this study that was reporting, as I said in the previous slide, you can see here, in the Turkish university, they reported 77% of the patient had ranged to 1.8 antibiotic per patient. In this study, compared with this study was 1.82 antibiotic per patient, so there's no difference between them. So, yeah. And some limitations was there that shows so that information was gathered from case note. There is a possibility that important data about patient worsening conditions of antibiotics. Okay, that about the usage of antibiotics have been not documented in the cases. That was one of the limitations they were explaining this. And so, based on this study, we can get one finding that is we need one, we have to highlight, or we need the urgent need for a regular point prevalence survey of antibiotic usage, and also we need implementations of an efficient antibiotic stewardship or antibiotic monitoring or video. Yes, and so we will go to the last part. Conclusions was been like this. First, non-uniformity or uniformity of antibiotic usage, and a high rate of needless antibiotic prescription, and prolonged administration was found that was called for stringent antibiotic stewardships. That means so the usage of antibiotic as needs to more monitoring for more information or detail about antibiotic in pediatrics. And this needs so many steps. I hope you're interested in this study, and if there's no questions, thank you.
In the exclusion criteria,
Okay.
you have written like we have to exclude congenital abnormality in
Yes.
patient with congenital. While like
Yes.
it will affect the selection of antibiotics.
Yeah. So I told you, as you see here, so they try to check this specific disease. As you see here, I mentioned the red color. So all of others, any other low abnormality.
Even in that patient, sometimes infection can happen and they'll use antibiotics. But why we
Yes.
are excluding that?
I don't know. They didn't explain anymore. Just they explain like this, as you see here, immunodeficiency and congenital abnormalities, and they didn't explain anymore about that. Why they exclude that? But especially they wanted to study in this few classification of the disease, not anymore. So they wanted to find out the group of disease, and other. Uh, I think so. It's because maybe they cannot get any result from this group of study, as you see here. So they were not sure or anyway. So they removed them. I think so.
Okay.
Any other
So
question?
what is the WHO protocol DAP 93.1?
Yeah, I wanted to check it, but there are so many things, and I couldn't find it. What exactly is this? And what?
Questionnaire is there.
Yeah. I,
What questionnaire for where the questions were from whom it was implemented?
from whom? Exactly, they were prepared for the who is prescribing, or all of the physician who is working the pediatric wards. They were making one questionnaire before starting the from hospital physician before starting the collecting data from physician. But if you're interested to know about this article, this protocol, I can find it out and share it in the group. Excuse me, sir. Can you repeat again?
Diseases, common diseases, common infectious disease.
Yes.
Objective, in the objective.
Okay. Yes. Sir, can you
Previously, healthy children means
yeah, I told you.
previously healthy children.
Yeah, so I told you this study have been done in the two parts, as you see here. How can I? Yeah, as you see here, where I have mentioned, as you see here, this study have been done in the two parts, first part and second part. So they were collecting data from those children with this red color UTI and others diagnosis, and they were checking in the first study. They were checking the prescribing pattern or antibiotic usage. And after a period, or after finishing of the first study, they will use those and those patients with this specific to check out what they was mentioned, to check out any prone and repeated and serious infection, to check out the effect of these antibiotics in the second study, because they were searching for dosing error and durations, how they're going in this two-study prediction. I think so.
Okay, any other questions?
Okay, Ramin, this is the second part of the study, isn't it?
Excuse me, sir?
This is the second part of the study, isn't it?
Yeah, this is the second part of the study, but they include the data from the first part. Based on that first part,
What was the conclusion of first part?
the first part, I don't know exactly. I didn't check it that. I have no idea. I didn't find it out.
Go to the results.
Excuse me, sir?
Results.
Results. Yes. This is the result.
In the last line of results, you have written appropriate route where something is missing after that in that line, I think. In more than 93% written.
What happened? What missing is it?
I think which route you haven't mentioned, I think.
Yeah, no, exactly. This was articles. They didn't mention which type of the route was there, and maybe it was mentioned in the tables, and I can check it. But as you see here, only like they mentioned, the proper route of was.
So according to you, like which route is optimal, IV or oral in pediatrics?
So as you can see here, look, just go to discussions. You can see here, just as a part of result dimension, and in the discussion exponent, like less than 90 and more than 90% of antibiotic was what parenteral, and this is it. Is it okay?
No, I meant
for journal club and all, no, you have to share the article also, man. Otherwise, we are like lost what exactly it is. We don't know complete information. Before that, try to share the article.
Okay, I will share the articles.
A little bit more complicated articles you have to take, man. Very simple one. It does not give much information also.
Okay, so I will try for next one.
Okay. Any other questions?
No, excuse me, sir. Sir, next we have Varun's session also, sir. After this, he is ready with the presentation.
50 years also
he
is
will
there,
share
no?
the link. Yes, sir. So now the fifth years will do. Yeah, according
Stop
to
recording.
the question, first
It's no
only
problem
fifth years,
for me.
sir.
You can do it first. After that, I do. Now I do, and then you do. It's okay. You just tell me when I can start.
So let's stop
Okay,
the
let him
recording.
do it.
So he is ready, sir. The Varun.
Okay, let him do it. Same link, huh?
Okay, sir. No, sir. He will send a new link, sir. Next 1 minute.
Quickly.
Yes, sir.
Shall I stop?
Stop.
Okay. Thank you so much.